In my clinic, I see a lot of patients with knee pain, and in general, this can be broken down into two different categories. One is arthritis. And arthritis speaks to the loss of the normal cartilage that we're born with. Having this cartilage in place, or this lining, helps keep the ends of the bone protected, prevents the bone from having raw nerve endings exposed, and helps the knee work smoothly and without pain.
This is an example of a normal knee. The femur is floating in the air on the screen, the tibia is on the bottom of the screen, and the meniscus is the small structure that sits between those that I'm probing on the right side of the screen. In this case, the patient has no arthritis, and this is a completely normal knee. For contrast, here's a knee with arthritis. There's significant fraying and breakdown of the cartilage on the end of the femur, which I'm probing. The meniscus, however, has some fraying, but is overall relatively intact.
In many cases, this type of wear and tear happens over the course of someone's life. Sometimes it's related to injury, but very rarely is an acute change. In other cases, there's pain that happens because people have torn their meniscus. And what the meniscus is a small, soft structure that lives within the knee, between the ends of the femur and the tibia. Meniscus tears cause pain in a different way than arthritis. While arthritis is the worn ends of the bone allowing nerve endings to be exposed, a meniscus can be thought of almost like a hangnail. It's okay until it gets moved, and all of a sudden it causes pain and catching, grabbing, locking up. There are different types of meniscus tears, and the configuration of the tear itself determines if we're able to repair it, which is relatively rare, or more often trim away the torn portion of the meniscus, leaving the remainder behind. It's really important to have an intact meniscus if at all possible, so we don't want to take anything that's not involved in the tear.
This knee has a large meniscus tear. We see this large fragment of tissue that's actually catching and grabbing inside this knee when the patient takes steps, and occasionally causes the knee to give way. Using instruments, we're carefully able to resect just the torn part of the meniscus, leaving the residual portion that's still intact behind.
With either of these conditions, pain is generated by inflammation and sometimes the mechanical symptoms of pieces moving around in the knee. We're able to treat the inflammation by using anti-inflammatories, injections, and physical therapy can help strengthen the muscles around the knee and make this less symptomatic. If we do get to a point where we've failed non-surgical measures, sometimes we talk about surgery. The difficult thing to consider is that in some patients they have arthritis and a meniscus tear, and in these cases the meniscus tear is likely not the culprit for causing someone's pain. We want to make sure we talk about this and understand this, because trimming out meniscus in the setting of a knee that has significant arthritis will often not make you completely better. There are other reasons for knees to hurt, and we'll talk about your specific reasons in our clinic visits.